Hello, everyone. This is Real Dr. Jin here. Welcome to the Real Dr. Jin YouTube channel. And today I invite a couple of specialists who recently got the COVID-19 vaccine. And I'm so honored to invite them because they are very busy and they spare us some time today to talk about it. And as everybody knows, we have a lot of exciting news recently, and the Pfizer vaccine was approved December 11, and 3 days later, some people already got it. So that's very amazing. We need to give some good thumbs up for this transportation and for this dispensing service as well. And as you know, Moderna, 1 week later, got also approved. So we have actual weapons to fight this pandemic. We hope we can share you more information, but if you have actual questions, you can leave a comment below. We will try our best to address your questions. And the first one we introduce you today is Dr. Tao. She's an anesthesiologist. Yeah, Dr. Tao, say hi to everybody.
Hi, everyone.
Yeah, Dr. Tao is an anesthesiologist practicing in the DC area. As everybody knows, a lot of sick patients, very sick patients, they resulted in the intubation. And Dr. Tao is the person who did this patient and saved the patient. Now let Dr. Tao introduce herself a little bit.
Hi, everyone. And it's my honor to be invited and to discuss with everyone, and I will share my personal experience with everyone, and truly an honor. Thank you.
Okay, and the second guest I invited today is Dr. Gui. For those who not familiar with the Chinese pronunciation, I think Dr. Gui. Dr. Gui is here, and can you introduce yourself to everybody?
Hi, I'm Dr. Gui. I'm the first year intern resident working in a community hospital in Bronx, New York right now. Sit here and discuss with all the specialties about the COVID vaccination right now. Yeah, just feel really honored have to discussion. Thank you so much.
Okay. I also see Dr. Pander is here. Dr. Pander, are you here?
Yeah, hello everyone. I'm Dr. Pander. Thank you for your invitation.
Okay, yeah, I think a lot of audience, you may know Dr. Pander already. He shared a lot of great information in his YouTube channel. Yeah, if you are interested in a Chinese way to learn this COVID-19, then you can subscribe to his channel. Yeah, and today we are going to discuss, and I will ask some questions, and the guests will may share their experience for this COVID-19 vaccine. Yeah, so let's start with Dr. Tao. So Dr. Tao, can you introduce how did you make appointment for this COVID-19 vaccine? Is that very difficult?
I would say the whole process is pretty simple. And what we do is the hospital I work for a week, because I personally got the vaccine on December 16th. But 1 week before, because I work for anesthesia department, so the department started to receive email from the hospital. So ask us if you're interested, you go online. So they give us a link. So you go online to register. So basically that's the Virginia government website. You go on there, you put your name and your birthday, everything information, and then they're doing a great job. So in the past, before I got vaccine, the 3 days, every day they send you a text, ask you, please remember you are scheduled on certain day to have a vaccine. So, everything was so streamlined. So by the time I finished my work, I went there within 7 minutes and I got the shot. So we were instructed after you get shot, you go to the auditorium. So everyone stayed there for 15 minutes in case someone have an adverse reaction. So I'm very grateful and thankful for this thing.
How about New York, Dr. Gray?
Hi. So yeah, as I mentioned before, so New York is definitely like was hit really bad back in April, especially in Bronx, where I work right now, where I'm working right now. So like for the hospital I'm working right now, there are lots of COVID patients, and for me, like taking care of a COVID patient every day, my department also like sent us a survey. I remember it was December 11th, the day on the day of her authorization of the vaccination. So at that time, yeah, I decided to have the vaccine. And on December 16th, I got a vaccination. And it's really interesting because I just gave like the oral consent. Then on the December 16th, my department just called me when I just doing my clinical service. I was talking to a patient at that moment, and my program director just called me. Oh, do you want to get a vaccine right now? So I was a little bit shocked, like, wow, it's so quick. So I say yes, because I taking care of the patients every day is like a really high risk, right? So yeah, I opt in. Then we just went down to a big room, and our department just have all the people set up there and doing the vaccination. So I would say it's really quick. Like only takes about like 5 minutes to get one people shot. So I know like for our department, almost two-thirds of people got a vaccination in the first round. Yeah, so that's our situation here. Yeah.
So it seems like in hospital setting to get a vaccine is not that difficult. Everything go very smooth, right? So
Yeah.
let me share about this urgent care setting. So because our urgent care is not affiliated to any hospital, so maybe our schedule will be a little bit later than the hospital setting. And I called the health department yesterday and put on hold for 2 hours. And then I can schedule for a vaccine for next week. So maybe the setting is different. So and the schedule will be different. What's your experience, Dr. Pander, in Alabama?
I'm a practicing medicine in southern state, and here our hospital have the first batch of Pfizer's mRNA COVID-19 vaccine. So right now, our hospital, 75% employee is willing to get the vaccine. So we started vaccination the past, I would say Wednesday. And, the people like doctors and nurses start to post their vaccination pictures on Facebook, on social media. So, and we always say, oh, great, we encourage each other. And so it's a really great phenomenon, and encourage each other because take courage, all right, to take a vaccination, because this is the first COVID-19 vaccine, and everybody has a question about this. But those doctors and nurses, they're willing to take the vaccine, and they know they kind of like a lab rat, okay? They're first group of people to take a vaccination, and the other 25% they suspicious about this vaccination. I think this is a phenomenon nationwide, maybe all over the world. Everybody has this kind of idea, the suspicion. But from my knowledge about this vaccination. I would say that it's safe, relatively safe, because I did a little bit survey in hospital. I talked to many nurses and doctors, asked them, what's your reaction? What's your side effect from vaccination? So I would say relatively positive. Majority of people say, oh, it's just like a little pain at the site of injection, and some people feel a little bit of fatigue, but majority of people say that's they can tolerate the little side effect, and they okay, they're happy. I don't see any like a big anaphylaxis event in our hospital. So nationwide, yesterday I posted a video talking about anaphylactic event nationwide. So far, by the end of December 18th, nationwide in the United States, there were 5 anaphylaxis event, 2 cases in Alaska. So, but the end of by the end of December 19th, about 270,000 people got a vaccination in the United States. So far, only 5 cases. So I would say that's relatively rare. I mean, it's like a random case. So I would say if any audience watching this video, watching this YouTube video, I would say, if you have a chance, think about this. I think it's relatively safe, you know. It's a part of like a mRNA pieces, and it's not a whole virus. So yeah.
Okay. That's good. That's very good information. Initially, I saw on the TV like some people like hospitalized, even get to the ICU because the vaccination. You know, for some like audience when they see this news and they may think, oh, this is dangerous. But thank you for sharing information like how many people got vaccinated, and only 5, you know, got some side effect, some real severe side effect, but none of them is like a very bad situation, right? Most of them get back to themselves very soon.
Yeah, I would say the worst case in Alaska. That's you know, she's I think is a nurse, and she got the tongue swelling, got hoarseness, you know, and has trouble to breathe, and she got the EpiPen injection, and they kept her in hospital for 6 hours. Then she went home afterwards. So that's the worst case. The other 4 cases are relative mild. So
okay. Yeah, so here we have 2 doctors get the vaccine already. Let's let them share some experience with us. Dr. Tao, how's your feeling? What's your experience?
Today is day 5. You see, I can raise my arm. No, it's no restriction at all. So the first day, I feel like my arm was less pain than the regular flu shot. So I was quite happy. The next day, it hurts pretty bad. I had a restriction. I couldn't raise my arm above my shoulder. But so the second day was the worst. And the day 3 was getting better. Day 4, no problem at all. So I never had any systematic reaction like a headache, a fever, or chill, never. So, but the people say the second shot, the reaction may be more significant. So let's see.
Yeah, the Moderna vaccine and the Pfizer vaccine, the second dose usually will have a stronger reaction. So
okay.
Yeah. How about
you said the Moderna case, right? Moderna.
Yeah.
Vaccine.
So Moderna vaccine, you will see more side effect. compared to Pfizer's vaccine. You probably will see the severe cases, 16% higher than Pfizer.
Okay.
So the reason is that I would say that because the Pfizer's vaccine is 30 microgram, and the Moderna vaccine is 100 microgram. So the dose, yeah. So the I would say probably the dose, the Moderna's vaccine is higher. So I don't know. Okay, maybe this is proportional to the percentage of side effects. Could be related. I don't know. This is my suspicion. So.
Right. We can see more data maybe later. Yeah. How about Dr. Gui? What's your experience?
Yeah, I had a really similar experience. So yeah, simply speaking, it's just like a soreness on my arm for 2 days. Most of my colleagues experience the same thing. I would say like 80% of people experience like just in terms of my colleagues, like 80% experience like 2 days soreness on the arm. It's quite common. I think it's like more. I would say it's more severe than severe than like a flu shot. Like to me, flu shot is like only 1 day arm soreness. However, this take like 2 days to recover. But generally speaking, I don't really experience anything like life-threatening. Or my colleague, I don't really see any life-threatening situation so far. Yeah.
So,
and also,
Dr. Quay, right? So my question is that when do you start to have this pain at the injection site? When?
So to me, it's like 3 hours, like 4 hours after the injection.
Okay.
Yeah, and most of my colleagues also experience the soreness for 4 hours or like half day after the injection. Then the soreness is like most in the second day. Yeah.
So you mean second day is a little bit worse compared to the first day?
Compared to the first day.
Yeah, but the third day, how much like improvement?
Third day, the soreness already disappeared. So
that's fast.
Yeah.
Yeah. Yeah.
So,
and for the audience, I believe if you choose to do the vaccination, I think you can do the left one. But if you lefty, you can do the right one, right? Because this soreness may bother you a little bit for the writing, for the typing, anything, right?
Yeah, I agree. Yeah.
Yeah. So I one time like I was in the doctor's lounge. So there's two doctors. They just got the vaccine. So I asked them, how do you feel? And both of them, they say, oh, I feel a little bit dizzy right after the vaccination. And then one doctor described the feeling that kind of like you're in an enclosed space with the machine, with the machine noise in the enclosed space. So that kind of feeling. So.
Like
I said, well, how can you get this kind of feeling right after vaccination? I don't get it. I said, how do you have that kind of feeling? They said, well, we just have that feeling. So.
Yeah, clinically, I have some patient, when I do a small procedure, and we do have some special patient, like if you just show them the needle or something, they can pass out to. You don't need really inject the vaccines. So I believe maybe when we give to a huge population, this symptom will happen too. So do you think, any of you think like how long like we need to observe the patient like after the vaccination?
I think, we were instructed to be observed for 15 minutes. But I think because that happened in the hospital setting, if things happen, you will be well taken care of. But I just imagine if this happened in the, when we give an injection in Walgreens, Walmart, CVS, in that setting, probably we should ask a patient to stay there like a half hour,
Right.
I think.
And
that setting
EpiPen,
need to have in that setting, probably we should provide either doctor or nurse, like with the epi, with the oxygen, emergency airway stuff, just be prepared. Because the worst scenario is truly like Dr. Pander said, the airway close up. That is the truly emergency,
So this kind of anaphylaxis, I look into the literature. Nationwide in United States, every year about 500 to 1,000 cases, and it happens really fast. When that happens, the IgE goes into your bloodstream. The type 1 allergic reaction that hits you really quick. Your blood pressure drop, and you have a quick heartbeat, and you have swelling in your oral cavity, and have trouble to breathe, then you could die after like a couple minutes. I don't want to scare you, but just and I talked to a nurse in the hospital, and she shared one story with me, and she said her one of her relatives went to a clinic and got antibiotics, Rosifin. So, and apparently she ran into an anaphylactic reaction, and she died within minutes. You cannot save her life. It happens so quick, So, because once the blood pressure drop, you either have an EpiPen, if an experienced, first responder can inject the EpiPen to you, okay, that might help you. But it takes times, you find the EpiPen, you hit you, inject it, and then you may need some IV fluid bolus. So that quick. So I don't want to scare any audience, but I just let you know that if it's the real deal, then it is quick.
Right. But as you said, it is rare, right? The situation is rare. And for the audience, I would suggest if you later have the chance, like to get the injection, do not drive, that may be the key. Another thing, you can like stay in one place for at least maybe 15 minutes or 20 minutes. That's a good choice, yeah?
Yeah, I would say that if I look into the 5 cases, in America, so far 5 severe cases. So guess what? Just one has like a history of anaphylaxis. So in Britain, those 2 cases, they have history of anaphylaxis. So therefore, they carry EpiPen with them. But in United States, 5 severe cases. Only one has a history of anaphylaxis. The rest of 4 probably has no history of a severe allergy. So, but if any of you, okay, listening to this YouTube video, if you have any history of anaphylaxis, you need to either consult your local medical doctor to think if you okay for this vaccine, because you look into the ingredients of this vaccine, see if you're allergic to any kinds of substance within the vaccine. I think that's the thing you can do. But if you have no history of severe allergy, you go to I will pick a either clinic or something. They have more staff or more first aid to help you. That's my take. So
yeah, Dr. Tao, what do you think?
I think that's a very good point. And in my anesthesia career, I did have to intubate 2 patients with airway obstruction right after, but both of them had lisinopril PO. And after that, both of them developed tongue swollen and difficult breathing and it's very scary, even for anesthesiologists. That's the, one patient I had was a patient was a truck driver, had a pill and was driving and feel like his throat was closing up. So he passing by a hospital and dropped into my hospital, went to the ER. And by the time I saw this patient in the ER, he was lips are so thick and the tongues are protruding. He was not able to swallow his secretion, so stuff was dripping down. A tongue was this way out, this much out. There's no way he can open his mouth, and his mouth was full of his big swollen tongues. He was a morbid obesity, like 350 pounds, and nobody take any history. So when I check on his chest, I feel like, oh, what is this? I have to write down, what is this? What is this pocket? He wrote it back. Okay, that he has AICD. Okay, so I basically communicate with him, collect the information by writing. Okay, so in that situation, I can't afford even to have any mistake in taking care of this patient. So I have to call the backup and send patient to the operating room, okay, and have an ENT standby, because if I fail intubate, an ENT can quickly do a tracheostomy. So that's the scenario, and I literally have 2 patients like that. Very, very scary. They both from the single pill, and they typically remain intubated for like 24 hours to 48 hours, and after that episode passed, after steroid treatment, they're just doing so much better. They go home. Amazing.
Yeah, so this kind of angioedema related to the lisinopril treatment, if you go to any major emergency room, you could see 1 or 2 cases every day, if for like a really busy emergency room. I mean, some cases can run into that kind of severe stage, you have to intubate them right away. Sometimes you even cannot intubate, it's too hard, that hard. So
you need to be alert about the situation, right? But don't be afraid, everybody. Like, this is very rare situation.
Very rare.
Yeah, very rare.
Prescriptions, like this observation is very necessary, right? Observation period. Yeah.
I would say that if you have a history of allergic to easy allergy, allergic to food, to nuts, and a severe allergic reaction, then you really need to go to some clinic or some some site with really good support to get a vaccine. But if you, hey, fine, very healthy, no other issue, never has any kind of problem with the allergic reaction, I think your chance to get into that kind of situation is very, very, very rare. So you probably will feel comfortable to go to CVS or walk in to get the vaccine. But if you have a long history, I bet there are some people like that they have are probably allergic to 20 medication, all kinds of long list of allergy. Then you need to go to a really sophisticated institute for vaccination. Otherwise, for very healthy, then don't worry about it. Don't get scared by this video.
Yeah, and Dr. Gui, and I know like you have a lot of colleagues got this vaccine already, right? Do you have any other similar experience, anything to share?
So far, I don't really see anyone have the anaphylaxis. So right now, people, like I said, most of them experience the arm soreness. I think that's, both the doctors mentioned early, just bring up a really good point. So I would agree, most of her, like, this is a really good point for not only for the patients or not for the community, but also for our healthcare provider. So I would say we probably need like more scrutinize the patients, the history, and also probably has to make a guideline, on the upper level, either CDC or kind of healthcare plan maker to think about what equipment we should have when we give the vaccine right now, to prevent, or at least you probably can save the life within the 5 minutes. So I would say screening history definitely is a really good point, but also equipment, like equipped equipment should be also the other consideration.
Yeah,
So
basically, I have another interesting situation today. Like when I schedule for this COVID vaccines, and the health department asked me, do you have a vaccine within 2 weeks? So I don't know if they ask you the same question.
Yeah, we do.
Yeah. So I think if that's the situation, if for some audience who have not got the flu shot yet, maybe it's better to get it now and later when they have the chance to get the COVID vaccine, they don't miss this opportunity, right?
Yes. I think they recommended when you get the COVID vaccine, and you should get it more than 2 weeks, 14 days, either before or after your flu shot. So if you get your flu shot now, 14 days later or more than 14 days later, you can get this COVID-19 vaccine. So it's very important to separate those two vaccines by 14 days.
Yeah, I also got some questions from my friends, some people also pregnant and they also interested in this vaccine. And I told them maybe the data so far is limited. I don't know if you have any good thought for that for the pregnancy population. Yeah.
One of my colleagues who is pregnant, actually one doctor is pregnant, the other one I know is a OR nurse. She's also pregnant. So basically a doctor who is my colleague, she decided to take it because considering it's a very difficult scenario for being pregnant during this COVID pandemic. It's very difficult. So basically you weigh in, even though the data is very limited, but you weigh in what happens if you get vaccine. What happens if you had this virus disease, you become short of breath, you might go to ICU. Considering all of this, probably take that potential risk of a side effect is a less of evil. So from that point of view, I think some doctors from online, and they recommend the people who either lactating or being pregnant mother. And if you are in the same category of being high risk, you are recommended to take this vaccine. You better just take it. But you have to go to your doctor to have this detailed discussion. Make sure you're fully aware of this potential risks, and then you decide if you still decide to take it, take it. Right. I think better to take it.
So I also have one patient, a very special patient today. She got the vaccine, the COVID vaccine 2 days ago. She's also a healthcare worker. And today, because she applied for some PA school, she needs the vaccine form. And when we review the vaccine form, we noticed her Tdap is more than 10 years. So then the nurse come to me, do you really want to give it or not? So I discussed with the patient. I said, now here's the situation. We don't have any data for this, no data at all for give another vaccine between the 2 doses of vaccine. So, and because she's healthcare worker, she balanced this risk and the benefit as well. And she definitely say, I will get it. I just get it and I will go for it, Yeah, we will, with more patients, come to this vaccine, we will have more situations.
Right. But hopefully more data will be collected and soon
Right.
we'll have a conclusion of how to advise patients.
Yeah. And
Yeah, so this is, I'm sorry. This is a big question for any young woman, young female, and like especially young nurses. Because in the hospital, I run into this kind of questions. They ask me, Dr. Pander, what do you think about this vaccine? Is it safe for me to take a vaccine because I'm gonna either like I plan to get pregnant or I'm get married or something like that, So I just tell them, I right now we don't have enough data for this, and if you really want to get this vaccine, just talk to your family doctor. Risk versus benefit. Think about this. But I will say that in the hospital, many young nurses they willing to take vaccine. So at this point, for audience with like this age, then at this age, I would say, I mean, the individual is different. Everybody has a different background. So and family history or personal history. Just talk to your doctor and then find the best solution for you. Risk versus benefit. Right now, there's no yes or no. So.
Yeah, so I also got some questions from my colleague who's like African American, and she's like very worried about this COVID because she learned the data, right? The African American was hit the hardest one, right? They have like higher mortalities, and so she asked if like for African American they need any bigger doses, like flu shot we have. Some regular dose and high dose for the old people. And she asked if African American, especially for some obese patients, need any like bigger doses of this vaccine. What do you think?
Well, I would say the mortality rate is higher because I mean, I would say the people with underlying medical condition, including like morbid obesity or diabetes, hypertension, or underlying immunocompromised situation, they have a higher risk, to high mortality rate, put that way. So if you are fit, if your relatively body mass index is less than 25, I would say you're like, and no matter what's your background, so you will do well, even you get infected, from my perspective, because I took care over I would say over 170 COVID-19 patient, based on my observation, if you relatively healthy, okay, no other underlying medical disease, then you would do well, you would do well. So, and the age play a big role. If you're about less than 50 years old, your chance to get into severe COVID-19 situations much less than people above 50. Then, if you're above 65, you have a higher chance to run into like a, severe condition. So age plays a big role. And if you have underlying medical condition, really make a big difference. So so that's my take.
Okay, so Dr. Gray, you work in COVID unit, right? What's your experience there? Anybody ask you this similar questions? Anything?
Yeah, I agree with Dr. Pander. So yeah, as my observation, I also the same thing. Most people like with BMI lower than I would say 25 are quite, even though they are hospitalized, they just spend like 5 days, finish treatment, finish the remdesivir and also dexamethasone treatment course, and their saturation, the oxygen level will come back to normal probably within 5 days, and they got discharged. However, those people, obese people, they got a really high chance to be sent to ICU. That's what I observed too. So yeah, this is a really good point for people, you know, to weight the risk and the benefit. And also definitely age is also you know, play a great role. But I do have a one patient. So one patient, like 99 years old male, got discharged. Yeah. So I'm really proud of that. Yeah. And also the other like 88 female got discharged. But I think they're just like individual cases. So I wouldn't really say, but you know, generally speaking, age still play a really great role. So I would recommend like the elderly. Definitely, they're more. You know, they should get the vaccination. Yeah.
And then Dr. Jing, I can answer a little bit answer your question also about the dosage. I don't think like you need a higher dose. The reason is that you know, according to the phase 2 research, they're talking about the antibody titer is 4 times more than the recovered COVID-19 patient. You know, the antibody. So the antibody titer is 4 times higher already with this current dosage. So I think it should be, you know, enough to protect you. You know, you. Right. I don't think you require higher dose. Even your if you have if you're big or the, you know, BMI is higher, I think the current dosage is enough. You know, 4 times. You know, so that's my take. You know? Right. Even for the because according to the research in London, there's a research about there's a group of health worker about 1,000 people, and the infected people they observed from April to, I think, from April or to November. So those people who got infected and recover, they do okay. They're okay. So the even natural infection can produce enough antibody to protect you already. And with the vaccination, you could have 4 times of you know, the antibody titer than the recovered people. So I think that from my understanding, that's quite enough. So.
Right, I agree with you. As you know, like before this vaccine was approved, right? We have like 10,000 people online discussing about every detail of these trials. And I believe they apply to this vaccine to like the whole population, different like different races, like different BMI. I think they have their data. They also recruit a lot of like big people or like different population people as well. Otherwise, you know, some very critical like expert, they will vote against it. Like as we know, when they discuss about like the age between 16 to 18, right? Some expert also
right.
critical about that, right? So they vote against it because they want to give to like 16 years old. They say the data is limited. Based on this, like I believe the clinical trial already have some good data for different kinds of races and different kinds of like BMIs people. Otherwise, they may just to rule out a special like population.
And also, I would like to add some something here. So for current dose we're receiving right now, actually, all the evidence are based on the phase 3 study, like Pfizer phase 3 study. So that dose has been set already. We don't really have the available data for like double doses or like increased doses. like whether it's getting more effective or side effect. You probably got a more side effect, but you don't really know because you don't really have enough data right now for like a double dose. So that's the issue I would be concerned because we're already talking about like the side effect early. So I would say just say the carbon dose as recommended right now, and as long as we are not doing anything like out of evidence, I think we're safe.
Yeah. So the phase 1 study, actually decide which is the right dosage for the vaccine. That's the purpose of phase 1 study and the safety. So I would say that the Pfizer, the phase 1 already decided, they picked the right dosage for the whole study. So they did something already. So.
Yeah, let's move to another interesting question. Someone also interested. I believe it's not our question because whenever whatever vaccine we have, we just get it. Moderna or Pfizer, but maybe like 3 months, 4 months later, they may have the opportunity to choose between this Pfizer vaccine or Moderna vaccine. Like, what would you recommend?
I think currently what they recommend is because both vaccine require 2 shots, right?
Mm-hmm.
They could recommend you stay with one kind, finish the 2 shots within that one kind of vaccine.
Yeah, don't change your mind, right? Get the Pfizer and then change to Moderna because you listen to Dr. Pander.
Yeah. So
right?
I talked to many doctors regarding these interesting questions because choose Pfizer versus Moderna. So I give you some interesting thought. So some people argue that, not argue, just their personal opinion that Pfizer has been there over 170 years. So it's a long history of like a big farm company. So they have a standard way to produce medication or vaccine, and versus Moderna is a really new company, very young company, and this their first product. So so that's one opinion. Okay, one opinion. But the other opinion is that Pfizer requires really low temperature to store this vaccine. So during the transportation, during the trip, they may lose some like
efficiency,
whatever. Versus Moderna requires less low temperature, like a 20, I think a 20 Celsius, and you can keep in the refrigerator for 30 days. So maybe the requirement is relative not that picky as like Pfizer, so maybe Moderna is better. But the interesting phenomenon is I talk about the anaphylactic event in Alaska. Right? They talk about the 2 cases. Like, how come you started the vaccination all over United States? How come there's a 2 anaphylactic event in Alaska state only? How can you explain this? So some people like to think maybe during the transportation, because the long trip, right? From Boston to their long trip. I don't know. Okay, some people talk about this. So it's just an interesting topic. So.
Right. I believe when they come to the choice, like they come to the opportunity, they can make this choice. I think we have maybe better data, more people got a vaccine already, and have some more detailed comparison between these 2 vaccines already. I think that time they may have some easier choice than we make decision now, right?
Yeah, but for audience, my thought is for you that right now we have a limited vaccine. Mm-hmm. Think about this. We have like close to we have over 15 million infected cases and over 300 deaths, 300,000 deaths at this point. So it's really critical condition at this point. And I don't think we can stop the pandemic by the end of January, because after vaccination, it takes about 5 weeks to produce enough antibody to protect you. To stop this pandemic, I will see that we may hit the plateau until the end of January. So by the end of January, even by the end of April, you will still see the number of deaths going up. Maybe hit like 450,000 deaths by the end of April or May. So for any of you watching this video, if you have a high risk, I would say it's not the time for you to pick which vaccine. You just get whatever you can get.
Yes, agree.
Right.
That's my thought.
So so I think the evidence we have right now is like both vaccination has pretty similar preventive successful rate, and also I remember pretty same like mortality for the elderly who got infected. So I would say like effectiveness wise, they're pretty the same. So we don't really need to spend time to compare right now, unless we have more data showing there's some difference.
Right. Just go for it. Yeah, just go for it.
But one thing I want to point out that this Pfizer vaccine versus Moderna vaccine. So for the Moderna vaccine, the phase 3 study results, they don't see any anaphylaxis event, no cases. So I would say that for Moderna vaccine, for the general population, we still may see severe anaphylaxis cases. So I just let every audience who watch this video be prepared for this, because Moderna vaccine still can cause anaphylaxis event. Not only Pfizer vaccine, the Moderna could cause some anaphylaxis event. That's my suggestion. So
we will see. Since now, like nobody got Moderna vaccine yet, right? So we just guess. But I believe like the rate is there. Even you get penicillin, you get Rocephin, you have the rate there. I don't know it's like which rate is higher for now, but later we will have some better data. And I also learned some new data today, and the US is going to vaccine about 20 million people in December, and 30 million in January, and 50 million in March. So we are going to have a lot of people involved in this like vaccination. I believe there will be different kinds of side effects over there, but so far, all this side effect is treatable, handleable. And as long as we prepare, and I think we can have a good way to prevent it as well. Yeah.
Yes, agree.
Yeah. And so I hope everybody enjoyed today's like discussion. We share our opinions, and this is just our own experience and our own opinion. If you really need to choose the vaccination and you have some concerns, it's better for you to discuss with your family doctor, because they know you better, and you can sitting down and make a decision together. And for those who have not subscribed to this channel, you can click and subscribe. We will have more good program and good videos for you. If you hit the bell, that will be better. The video will go directly to your phone and to your computer. Yeah, and I'm very glad we can discuss tonight with a lot of doctors who have this vaccine already. And I hope this opinions and this experience will help you to make your decision to get the vaccine later. Thank you, everybody.
All right, thank you. Bye-bye.